Yes, the British Prime Minister Boris Johnson has announced strict new measures he hopes will stop the spread of the coronavirus there. There have been more than 6,700 cases in the UK and 336 people have died. From today, people will only be allowed to leave their homes to buy essential goods, to exercise once a day and to travel to and from work if they can't work from home. Public gatherings of more than 2 people will be banned, all shops selling non-essential items closed, as will libraries, playgrounds, gyms and places of worship. Boris Johnson says it's vital people follow the rules and police will have the power to enforce them.
The coronavirus is the biggest threat this country has faced for decades, and this country is not alone. All over the world, we're seeing the devastating impact of this invisible killer. Without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, enough intensive care beds, enough doctors and nurses. And as we've seen elsewhere in other countries that also have fantastic healthcare systems, that is the moment of real danger. To put it simply, if too many people become seriously unwell at one time, the NHS will be unable to handle it, meaning more people are likely to die, not just from coronavirus, but from other illnesses as well. From this evening, I must give the British people a very simple instruction. You must stay at home.
That's the British Prime Minister Boris Johnson in a national address a few hours ago. The death toll in Italy is almost double that of China. More than 6,000 people in Italy have died as a result of the coronavirus. Authorities there say more than 600 people with coronavirus have died in the last 24 hours. The figure is slightly lower than the last 2 days. Infections in Italy have risen again, but for the second day in a row at a slightly lower rate. And the tough lockdown measures there are about to get even tougher, as the BBC's Mark Lowen explains.
Tightening the screw on people and the virus. 2 weeks into a nationwide lockdown, the measures are toughening again. Italians now banned from leaving their town and travelling across the country. Not since wartime curfews have these scenes played out.
Well, the limits on movement are being stepped up with ever more police spot checks to see if people can justify why they're out. And yet polls suggest that most Italians would support even tighter restrictions. There is virtually no sense of rebellion or complacency here.
With streets deserted, all non-essential companies will now be shut down too. Italy is running out of things to close. Still open is this laboratory where they're working on a coronavirus vaccine, DNA injections to produce an immune system response. They're aiming for clinical trials by the end of the year.
We are going to use a genetic vaccination that is a fragment of DNA that is injected into the muscle. We are really confident this technology will work, since we have been using this technology to generate anti-cancer vaccines.
It can't come fast enough for hospitals in the worst-hit region of Lombardy, where all 800 intensive care beds are now taken. 24 doctors have died. Latest figures show a slowdown in new cases, but experts warn caution.
We have to wait more days to evaluate if this decrease continuing in the days or is just a good news of a day. But I trust in this containment of a virus.
That report from the BBC's Mark Lowen. Health workers in Europe are pleading for more protective equipment as they watch colleagues die after contracting COVID-19. The World Health Organization says the global community must urgently increase the production of masks and protective clothing. Doctors are dying in France and Italy, and Spain says health workers account for 12% of its 33,000 cases. In the US, New York's Mayor Bill de Blasio is warning if the city does not get more ventilators in the next 10 days, he's concerned the death toll will continue to climb. An official with the American Hospitals Association has told CNN every hospital in every community is expecting shortages of critical supplies. CNN's Nick Watt reports.
This massive Manhattan Convention Centre about to be converted into 4 field hospitals, 1,000 beds between them.
We have not even begun to see the influx of patients. this is still the relative quiet before the storm.
Every hospital in New York was just ordered to increase bed capacity by 50%. New York State, now home to around half the confirmed cases in this country, now more than 20,000. That's tripled in 3 days, and more than 150 have died already.
If we don't get the ventilators in particular, we will actually start to lose lives who could have been saved.
The state says many cases are ages 18 to 49. Experts suggest vaping might be a factor.
You can get it. The numbers show you can get it if you're a young person.
And there is yet more conflicting messaging from the administration. Here's the Surgeon General on the Today Show. He strongly supports social distancing.
I want America to understand this week it's going to get bad. It means everyone needs to be taking the right steps right now, and that means stay at home.
But just last night, the president on Twitter suggesting strict rules on staying inside might be relaxed just a week from now. The restaurant and food industry alone estimates 7 million could lose their jobs. Jay Boken already has.
People are not going to be able to support their families.
And stay-at-home orders still spreading. Ohio, Louisiana, Connecticut, Indiana, West Virginia and Michigan among the recent additions. But not everyone apparently taking social distancing seriously enough.
We can't have the kind of social distancing that parts of Italy had, or we will turn into Italy with those case counts and those death rates.
More than 6,000 have now died in Italy, among them more than 20 doctors. Here, thousands of retired healthcare workers now heeding the call to come back to work.
I feel I have a moral obligation to share my skills. We can't imagine what it's going to be like a week or two from now.
Disaster declarations declared now for New York, Washington State and California. FEMA working to bring an extra 5,000 hospital beds to those states. And Mercy, the Navy hospital ship with 800 personnel aboard, today setting sail for Los Angeles.
Nick Watt with that report. Mainland China has recorded a drop in its daily tally of new coronavirus cases, reversing 4 straight days of increases as Beijing ramped up its containment measures. China had 39 new confirmed cases on Sunday, down from 46 a day earlier. All the new ones involved travellers arriving from overseas, many of them Chinese students returning home. Medical workers across the world are urging people to do what they can to help, and that is to stay at home. This plea was issued by a team of specialists in Belfast.
I'm Nick, and we are the Belfast Respiratory Team. We are now in the greatest medical crisis of our lifetime. Stay at home.
I'm Angela, one of the respiratory consultants. This is the crucial time. This is not a rehearsal. You will only have one chance at this. Stay at home.
I'm Claire. I'm a respiratory nurse. You can play your part to enable us to play ours. Please stay at home.
And that's World Watch for today. Back to you, Mani.
Thanks, Annabelle, and that's Midday Report, Te Pūrongo o Te Pautūtanga. Government ministers are providing a briefing at 1 o'clock. RNZ National will bring that to you live. And Checkpoint will be with you at 5 o'clock with all the reaction to the day's developments. Here's the news.
News at 1 o'clock. Good afternoon, I'm Paul Brennan. In about 2 hours, the government is expected to announce further support for businesses during the COVID-19 lockdown. The wage subsidy has been extended to all businesses, but Prime Minister Jacinda Ardern and Finance Minister Grant Robertson are due to speak to media later this afternoon. They're expected to announce further business lending support. Meanwhile, the Director General of Health, Ashley Bloomfield, and others from the all-of-government National Response Team will give a media conference at Parliament shortly. We will cross to that live. Figures from the FPOS provider Paymark show yesterday's supermarket spend was surpassed only by last year's Christmas Eve shopping. Spending at food and liquor shops jumped sharply to $111 million, 157% up on the same Monday last year. Business at pharmacies was up 122% on last year. Spending at bars, restaurants, cafes and on accommodation has dropped. Growth in spending over the last week was highest in Wairarapa, where it was up 20%, and lowest in Otago, where it fell slightly. The Alcohol Beverages Council is calling for...
Welcome everybody. Thank you for being here. As I mentioned yesterday, this stand-up will normally just focus on a few different issues each day to try to keep people up to date with what's going on. Today I've got Ashley will give his regular health update as part of this. I have Iona Holstead with me as well, who's the Secretary of Education, who can talk about schools, and Paul Stocks from the Ministry of Business, Innovation and Employment, who will talk about the work we're doing to get clarity around essential services. Just before going to those, just to note that our response to this COVID-19 disease is unprecedented. We've got staff working from across the public and private sectors, working hard to continue to deliver essential services to New Zealanders. And I want to thank those people right across the public and private sectors who are carrying out those essential service roles. Staff are working at pace and things are changing, and I know many will have questions and we'll do our best to answer those. From midnight, 1 minute before midnight, tomorrow night on Wednesday, everyone must stay at home unless they're working in essential services, and Paul will talk more about that a little bit later. This means that people must stop interactions with others outside of their households. Self-isolation is a very effective way to help protect all of us, our families, whānau, friends. You must spend time just with those with whom you are in self-isolation, and keep your distance from everyone else at all times if this is to work, and we must make it work. You can still go outside, go for a walk, exercise, take your children outside, but keep 2 metres away from others at all times. You may recollect yesterday I spoke of the need to have physical separation, but to maintain social connection. Over the next 4 weeks, that's going to be very important, whether that be over the phone, over the fence, but always 2 metres apart. Food will always be available. You can continue to go to the supermarket or to a pharmacy and so forth. But again, keep your distance from others. And if you are coughing, sneezing and spluttering, please do not get anywhere near anybody else. We absolutely need everyone across society to observe these requirements so that we can protect New Zealanders and slow down this disease. And we will have to take enforcement action if that does not happen. We know that's asking an awful lot of people, but this is our best chance of eradicating the disease and making sure that our health system can cope. Our national leadership team is pulling together the many agencies that keep New Zealanders well and safe and to keep the economy running. The National Crisis Management Centre is coordinating multiple streams of work, as you'd imagine, across government, and these are continuing to ramp up. I have been asked by the Ministry of Foreign Affairs and Trade to reiterate a couple of key points from them. These are not matters I'll be able to answer any questions on, but it's a message to New Zealanders overseas. We're asking them to make plans in case they cannot find flights home. The most up-to-date information is available on the Safe Travel website, and all New Zealanders overseas should visit that website and keep up to date. The Ministry would also like to recommend that those New Zealanders that they should not rely solely on government-assisted flights. Now, just before I hand over to Ashley, I'd like to remind everyone that the covid19.govt.nz website is the first point of call for updates around government actions, help and advice and resources. It is updated constantly, and we're seeking to make it the best source of information for everyone. Now, I just want to hand over to Ashley to give the health update, and then he can answer questions on that. Ashley.
Thank you, John. Kia ora koutou katoa. So there are 40 new confirmed cases of COVID-19 in New Zealand as at 10 o'clock this morning. We also have 3 new probable cases. In these cases, this is a person who has returned a negative laboratory test result, but the clinician looking after the person has diagnosed them as a probable case due to their exposure history and their clinical symptoms. These cases are actually treated as if they were a positive laboratory confirmed case, and the actions taken are the same as for confirmed cases, that is self-isolation and active contact tracing. So therefore, our combined total of confirmed and probable cases is 155. And we will now report the total combined confirmed and probable cases each day. More details of the new cases, including the probable cases, will be provided via our website, that is the Ministry of Health website, shortly, and updated as new details emerge. There are 12 cases that we can confirm are recovered. We will be updating this number also on a daily basis. Our laboratories across the country are working to process and report all test results as quickly as possible. Anyone who has been tested is expected to be in strict self-isolation until advised of the result of their test. So far, we have information on around 1/3 of the new cases that I'm reporting today, and all of those that we have information on have a link to overseas travel. This may include being in the same household as someone who has travelled back from overseas, or they have been at a known event where transmission was occurring, for example, the Hereford Cattle Conference in Queenstown earlier this month, or they are close contacts of an already confirmed case. So recent travel from overseas is still the main driver of our new infections. Anybody who has recently travelled back from overseas should already be in strict self-isolation, no exceptions. Close household contacts should be particularly vigilant for any symptoms they may develop. At this point, we are classifying 4 cases as community transmission, 3 in Auckland and 1 in the Wairarapa. That is 2 more than yesterday, and in these cases we have been unable to confirm a definite link to overseas travel or to an existing confirmed case. Contact tracing is, of course, underway for all those cases. We continue to look carefully at all new cases as more information is reported by Public Health Services to identify evidence of community transmission. More than 900 laboratory tests were carried out yesterday, bringing the total number of completed tests to over 8,300. We continue to test people who need to be tested. As John has said, and as you will be well aware, we are preparing to move to Alert Level 4. There is a clear consensus amongst public health professionals, scientists, and a wide range of health professionals that it is better to do this sooner rather than later, and doing so gives New Zealand the best chance of breaking the chain of community transmission. This will require all our efforts, and I strongly urge all New Zealanders to play their part. That's all I have to say, and what I'm going to do is take questions now related to health matters or issues I have talked about, if there are questions.
Are you able to say, how many cases are in hospital, have been hospitalised?
Yes, at the moment there are 6 people who are in hospital, and they are all stable, and none of our cases to date has required intensive care admission. So those people in hospital are all stable. That's quite a low proportion, as you'll realise.
For the Ministry to urgently expand case identification and tracing, will this happen?
So the case identification is through the laboratory testing, and you'll have seen the increase in testing over the last week especially. So we are finding cases, and that's what we want to do. We continue to increase our laboratory capacity, again to ensure that all people who need testing are tested. And then there is also an increase in our capacity to follow up and contact trace from our confirmed cases.
Once we have that capacity, will you expand the testing criteria? Because it seems like we may be missing some cases.
So there is nothing that is restricting testing at the moment. There has been for well over a week now an expectation and or an enablement of clinicians to test people who they think require testing. What the expanded laboratory capacity will allow us to do is, if we have particular clusters, we can do intensive testing in an area or in an organisation or a school to, for example, or what would have been a school that had been opened, to identify any cases there.
Get some clarification from you around essential services. There's a bit of confusion about who can open and can't, but things like Bunnings, things like Mitre 10.
Are they considered essential, and if some places are able to remain open, will that blur the lines of what we're trying to do?
So one of the subsequent speakers will talk specifically about essential services, but what I can confirm, of course, is that health services are highly essential services, and they remain open, including primary care, pharmacies and hospitals working as usual.
Are there any cases in rest homes or among healthcare workers? Any confirmed cases?
Yes. I'm not aware of any confirmed cases amongst healthcare workers. I am aware of one confirmed case in a rest home in Auckland. That's all the information I have.
How is that being managed? If that's been identified, are there going to be increased measures in terms of, staff protection and testing in that rest home?
Yes, so very careful identification of any people in the facility was undertaken, and staff who may have been exposed, and those people are being looked after in what you might call a bubble to ensure that they are strictly self-isolated and being monitored, of course, for any symptoms.
Concerns about the vulnerability of that particular cohort of people in that rest home, obviously because of the age, apart from anything else?
Well, a concern generally about the vulnerability of people in aged residential care facilities, and in fact, almost 2 weeks ago we proposed to aged residential care facilities that they stop visitors coming, and most around the country had already done that and now have put in place much stricter protocols. And of course, some of the measures that the government has taken to provide economic relief are specifically designed to ensure that staff of those facilities are not disadvantaged by staying home if they are unwell, so that that reduces the risk to those people too.
How many people have tested positive from the Hereford conference?
My recollection is that the number of people from that conference is now 6, 4 of whom are in New Zealand and 2 from overseas, 1 in Uruguay and 1 in Australia.
Just clarify if visitors are going to be banned from coming into hospitals from tomorrow. What situation is there?
So hospitals have received information about a very clear visiting policy. It won't be banned per se, but there will be very significant restrictions on visitors.
Are pregnant women considered high risk? And if so, what does that mean for pregnant healthcare workers on the front line?
So pregnant women are not considered at a higher risk than any other adult, but of course it would be very important to protect pregnant women from becoming infected. And I suspect that many pregnant women are already self-isolating and making sure they are reducing a risk of infection. In terms of healthcare workers, of course, we would be looking to identify any healthcare workers, including those who are still working who are over 70, and people with pre-existing medical conditions, and we would put pregnant women in that same category to ensure that we can put them on work inside our hospitals or other healthcare settings where they're not to be exposed to people with COVID-19.
Is the loss of the sense of smell, is that a symptom for COVID-19?
I understand. I just saw an article overnight actually where this was being reported, and evidently this was something that also was found after the Spanish flu, or actually no, after the Spanish flu a century ago, that there were people who had the flu that then developed Parkinson's symptoms. I would say this is an incidental finding and something that researchers will follow up now, that some people seem to be reporting having a loss of smell and taste. Yes.
How long averages the testing process taking, moving from the collection of a swab to a confirmed result?
Well, it depends where the swab was taken, because we have the 5 laboratories around the country now processing, so it takes time to get the swabs there. But we would be aiming to get from the swab to the test result be notified to the patient within 48 hours. That would be what we would be aiming to do. Of course, just to reiterate, anyone who has been tested is in self-isolation until they get that test result.
Can you give some clarification around health workers who are in families? If you have a health worker who's a parent, a brother, sister, whatever, do they need to isolate from the rest of the family because of the exposure that they're getting?
Only if they might choose to do that, or they might need to do that if they are looking after someone with COVID-19, and that would be something to look at. Remembering at the moment we've got 5 people around the country in hospital, and they are all being cared for in special settings, so negative pressure ventilation rooms with use of PPE, of course.
So it's not strong advice on that. It's not a you must. It's up to a health worker to decide whether they stay living with their family or not during the lockdown.
Well, as I say, at the moment we have a low number of health workers in, a low number of people in hospital with COVID-19. That would be something we would look at, but I'm sure that everybody will be looking to minimise the risk to other members of their household over coming weeks, including health workers.
Perhaps just
a couple more questions.
Just a couple more questions on health, and then we'll turn to the subject of education.
In terms of personal protective equipment, the World Health Organization is warning about possible global shortages and they want manufacturing increased by 40%. What is New Zealand doing? Do we have an accurate stock take of our supply of that?
We have both an accurate stock take, or we have a stock take of our supply both in our national store and already in our district health boards, and we have a lot more being manufactured at this point in time with the good fortune of having, or the good planning of having our own factory here in Whanganui, so millions more masks being produced, in particular masks, and the initial production was 200,000 masks a day, and that's increasing. So we're very confident about our access to PPE here. So question after that.
How is that contact tracing going for the cases of community spread, particularly the one in Wairarapa?
I don't have any further details on the Wairarapa case, but obviously where we do think there is community spread, or we can't identify the source of the infection, then there is a lot of work that goes into actively tracing back through the chain to see how many people the case may have had interaction with, particularly close contacts, and those people are all put in isolation and monitored. One last question.
Do you know specifically where in Auckland the cases of community transmission are yet?
Let me think. So yes, there is one person who is in Orewa, and he had travelled to and done a tour to Milford, and so we're assuming that probably he came in contact with someone, an overseas traveller who was infected. So that's likely, but we can't rule out community transmission. So both he and his partner have tested positive. They've been in strict self-isolation. The other one is another suburb in Auckland. I can't remember. Sorry.
Could it be made available or sent out so that some point today?
We can have a look at doing that, yes. Thank you.
Resources like swab tests and protective visors, that's what we've heard, and what are you doing to source more of those?
So we don't have an issue with the supply of those, but of course what we need to do is make sure that wherever they are needed in the country, we're able to resupply practices or district health boards as soon as possible. So there's a team working on that constantly. Thank you very much. I think those are all the health questions.
Thank you, Ashley. That's great. And with that, I'd like to invite Iona Holstead to come up and talk about what's happening in the schooling sector. Iona.
Tēnā koutou katoa. First, can I start by thanking all of our schools and early learning centres and tertiary leaders who have shown considerable stewardship in the last few weeks. This has been an unprecedented event and will continue to challenge us all. Your input and support has been invaluable, as is your commitment to making sure your children and young people are able to continue their learning with the support of their parents and caregivers. I also want to iterate John's message before about the need to reduce the number of contacts as we go into this closed down period. The Prime Minister's message yesterday talked about needing to have a circle of care to support those people in need during the 4-week closed down period. So while the ideal arrangement might be that you limit your connections to your immediate family, we know that in practice some people will need help from others. In the case, for example, of a child of an essential worker who cannot stay home and they need to have a child cared for, if they identify a trusted buddy, as long as they're not elderly or vulnerable in other ways, and if that person is identified as part of your self-isolated group, they become the child's caregiver. However, it is critical that that buddy cannot then have other contacts other than their own household. You all become one group, but it should be a tight group. The smaller the better. Another example could be helping a family with care for their disabled child to give the primary carers some time to rest. But again, you need to be identified as part of their self-isolated group, and you cannot have other contacts other than those in your own household. As the Prime Minister said, consistency is key, and making sure that we all have a very tight circle of care is needed to minimise any risk of spread. Again, the smaller the better. You'll appreciate our foremost priority since yesterday's announcement has been to make sure that all schools, kura, early learning services and tertiary institutions have been given all of the information that we have to keep them up to date. The Ministry will be working over the next few weeks to provide support for distance learning. We'll be pleased to connect with teachers interested in working with us. And we're sourcing devices and working through the logistics of getting them to students that need them. We're also working through issues where access to the internet is needed, and while this is a big and complex project, we are making progress. I'm happy to take any questions.
What are you doing for low decile schools that perhaps kids don't have that technology at home, don't have internet speed? How are you dealing with that?
We're identifying those schools area by area where we believe there's a gap, and we have sourced devices. We've now got a slightly difficult logistical situation of actually getting devices to the right homes, because of course they will have to be delivered to homes rather than to schools. But it's important to also understand that in many low decile areas, the internet connection is not there either. So the provision of devices will not suffice. We are working for N4L, which is a Crown-owned company that does the fibre into schools, to create connectivity wherever possible. But where that's not possible, it'll have to be hard copy. And we're working with our suppliers to make sure that can also be delivered to homes.
So working with that provider, what's the time frame on that? Could that be days? Would it be weeks? Would it be months?
The material that we're expecting from the hard copy is between 5 and 10 days.
I mean, with setting up. So if there's a provider who's who's working with schools.
No. So I mean internet provider.
Yes. So are we talking about days or weeks or?
It will vary. In some of those areas, there won't be internet coverage at all. So we're working separately with television and radio. Those spectrums do, of course, go ubiquitous, and we're working with them early days on how we can use those services to beam into kids' houses too.
What's your message to parents or students, particularly in those senior years, who are really worried about NCA, about assessments, about how this month is going to affect their performance this year?
That's the reason, of course, that we expect senior secondary schools to be able to provide online learning, and many of them do. Most of them have got capacity to do that. My advice to those students is to use the time to study. NCEA is not at risk yet, and assessment will need to be shifted around a bit. If this is prolonged, of course it will be affected, and NZQA will provide advice to those schools and to those kids as to what they need to do.
Is there a big risk here though, and obviously understanding the whole situation, that children's learning might be disadvantaged because of resources or just where they are, and I suppose it comes to Jess's question, how do you really make sure that that's as even as possible for all kids?
It's in a situation like a pandemic, it reveals the inequity in our system. It doesn't create it. Many children in this country suffer from poor learning outcomes because of where they live and the lack of support they have. This actually might be an opportunity to give them more resources.
Healthcare workers, can you just tell us a bit more about the body system or any other ways healthcare workers can get their childcare when they don't want to leave them with grandparents?
We're working today on an option for that, along with the Ministry of Social Development, to identify organisations that may be able to help. Naturally, anybody who provides any of those services, though, would also have to meet the public health guidelines in their dealings with those children.
There's concern that children who rely on food in schools, they'll go hungry during this time. Is there any consideration being given to distributing those services in another way?
Yes, there is. Some of the providers have already indicated they can do that. So those are voluntary organisations. Kids Can, I think, publicly stated that the other day. Our own Food in Schools program, which is very, very new, we're just going through case by case to see whether or not there is anything we can do to repurpose that. That is difficult because the provision of food, obviously, creates a risk. So we have to have very, very high standards to ensure that we're not doing damage.
Nanny agencies are being called by essential workers needing urgent childcare, and former hospitality workers are becoming nannies. Is that okay, and with families having new people coming into their homes at times like that?
Well, that's up to each family to decide. The particular example I think you're referring to, my concern would be around police vetting, because I, like you, probably read that online, and noted that they were looking for urgency around police vetting. What we do know is there's large numbers of early childhood staff who will also not be in the early childhood centres. We know that there's organisations like Pors and Barnardo's who've got staff who have been police vetted and have got experience. So we were looking to how we can join people up with those sorts of known services.
Perhaps just another last question on education, or is there none? If there's not, Iona, thank you very much indeed for joining us today. And I'd like to invite Paul Stocks, who's Deputy Secretary at the Ministry of Business, Innovation and Employment. Paul's working with a group of people looking at the issue of essential services and lists and so forth. Paul.
Thank you, John. Kia ora koutou. I'd like to talk through the work that's been happening to date and the decisions on essential services under an Alert Level 4. I suppose to start, though, just a reminder that the purpose of Alert Level 4 is to eradicate and eliminate COVID-19 in New Zealand. By definition, this means that life under Alert Level 4 will not be the same as under Alert Levels 1, 2, or even 3. The purpose of the Essential Services List is not to ensure that life goes on unchanged, it's to ensure that we are able as a nation to self-isolate and eradicate and eliminate COVID-19. The purpose is to ensure that we provide for the necessities of life, for health, for safety, for welfare, and for essential infrastructure. What that also means is that when we think about whether something is an essential service, there are two tests. Firstly, is it essential for those purposes? And secondly, how might it be delivered in such a way as to limit the risk of spread and transmission of COVID-19? To date, we have identified 15 sectors that are considered to be essential services. You can find those on covid19.gov.nz. We have allocated lead government agencies for each of those sectors who are working with those sectors, whether that is accommodation, whether that's transport and logistics, or whether it's utilities, to ensure that those essential services know who they are and know the steps that they need to take to provide for New Zealanders through the Alert Level 4. We will continue to update that website, and from 5 p.m. today, there will be an 0800 number where firms can call in if they are unclear about their essential services status. This is a principles-based regime. We won't be able to list every firm in the nation. My suggestion, however, is if that you are in doubt about whether you are an essential service, you're probably not. We will provide support. We will help you to identify if you are. We expect New Zealanders, firms, businesses and people to assist in the self-isolation process, not to assume that they are an essential service when in fact they are not. We will help you make those decisions. If we have helped you and you continue to provide services, we will help you further, and that'll be in the form of compliance and enforcement. As I've said, this is an evolving situation. We are working with firms today to identify the core essential services. We will update on the website, and we will have an 0800 number, and I look forward to your assistance in that. I'm here to take questions.
The big questions we got yesterday from people, the big questions we got from people yesterday were, what can they do for supermarkets, service stations, that sort of thing? Can you very clearly lay out how people can access those services, and what the situation is with public transport, i.e. buses and trains versus taxis? Very clearly.
So far it's been very clear. The essentials of life, and that includes supermarkets, will remain open. There will be an ongoing supply of food and essential supplies. Supermarkets are already taking steps to ensure that self-isolation can proceed while people are shopping. I know that's in situ shopping, and we're also looking to do online contactless deliveries. Similarly, essential infrastructure like service stations will remain open and will be supplied. When we're talking about essential services, we are talking about the point of delivery and the supply chains that sit behind those essential services.
How do people get there if they don't have a car?
So if they don't have a car, then there are facilities for using transport. We're working through the transport operators now where you can self-isolate. For example, if you are taking a taxi, then you should sit in the back seat to maintain as much distance as possible. Public transport will remain open for essential services workers. I've seen already, for example, in terms of parking, that Wellington City Council has announced that parking will be free during the period of Alert Level 4. I think that's good. It provides for transport options for essential service workers.
But people can't rely on buses and trains over the next 4 months to get to the supermarket or the doctor or the, not the service station if they're not an essential worker?
So it's 4 weeks for the alert level 4. Yeah, so transport is considered to be an essential service and will continue to operate, and we require social distancing while it's being used.
Some clarity around places like the warehouse being open. What's the thinking behind that?
So the government has not decided that the warehouse will be open. We are working through those firms that will be required or allowed to remain open. I would caution firms from leaping to judgments about what their status will be before they have received an adjudication from the government.
Do you think the warehouse...
I don't want to go through a list of individual firms or businesses today. Yes, I understand that. We are working through how do we ensure that essential services and goods remain available to New Zealanders whilst reducing the risk of spread. And one of the things we're clearly thinking about is that we don't want a bunch of people showing up to retail stores.
Is the warehouse a necessity of life?
I don't think any particular firm is a necessity of life. The goods that they supply might be, and we'll have to think about how they are supplied to New Zealanders.
What about food suppliers, like those smaller food suppliers, like dairies, like butchers, like bakers? You said supermarkets are open, but what about the small ones?
Yeah, we are also working through, because, of course, around the country there are different circumstances for different communities. We want to make sure that all communities have access to food and essentials, and whether that's through a small supplier or a large supplier is not the key test. It's how do we make that available, so we're working through that now.
One last question.
Essential workers. Ashley Bloomfield mentioned before about health workers and them choosing whether they want to isolate from their families or not. People working in supermarkets, big stores that are still going to be open, they're going to have a lot of contact with the public still. What are they need to do if they are then going home to families? Take a supermarket, check-out person, for example.
So I apply the same judgment that Dr. Bloomfield provided you. So we do ask people to take care for themselves. I know that supermarkets and other stores are already taking active steps to minimise the number of people in store at any one time, which facilitates social distancing that's required. I think everyone should take care, maintain that distance, and when they return home, enter into self-isolation. Thank you.
Last one.
Please clarify if liquor stores are an essential service.
Sorry.
Can you please clarify if liquor stores are an essential service?
We're very aware of the issues that are raised by that question, and we're working through it right now, so we'll provide clarification in the day.
Okay. Look, everybody, we've used our time available. I think this, as you can imagine, Paul and a bunch of officials are working through this stuff right now. There'll be further work done during the course of the day, and my intention is that there's far greater clarity by the end of it, and we can answer more questions tomorrow. So thank you very much. As I said, we're working through it today. I expect there to be far greater clarity by tonight on the website. It won't be perfect. We'll have to keep finessing it. We're going into uncharted territory. So please just bear with that. And no, I'm sorry, I said it was last question. So.
Window. And you alluded to it in your opening statements that people can't, people overseas. Are there any arrangements to help put on extra flights, extra transport?
I'm sorry, I can't answer that question, as I said earlier. Thank you very much.
I'm just going to hijack the fact that people are here to do a